Some Mid-South parents may have to add one more item to their back-to-school to-do lists. In Tennessee, state health officials have announced new rules on steps you'll need to take to protect your child's health. Doug Johnson has the details.
It's something that every parent and child deals with. Trips to the doctor's office for examinations and immunizations. Most kids get a series of vaccinations beginning in their first year of life, almost an alphabet soup of shots. DPT, MMR, PCV, Hep A, Hep B. While young patients may put up a fuss, those vaccinations offer years of protection.
Well, I think before they weren't actually following up on what happens after 9-10 years of the first initial immunizations, and now they're starting to realize that there's some waning immunity. So a lot of kids are getting sick with illnesses at older ages that I guess, doctors weren't really paying a lot of attention to the fact that this is actually something that they were immunized against. They shouldn't be having this. So now they're saying, let's give another immunization.
New immunization requirements from the Tennessee Department of Health went into effect across the state on July 1st. Children over 18 months old must now get a dose of the hepatitis A vaccine. Children in pre-kindergarten or child care require a hepatitis B vaccination and immunizations for meningitis and pneumonia. New kindergarten students who haven't already had a case of the chickenpox require a second dose of that vaccine.
It's probably easier to keep track of immunizations in younger kids since they tend to go to doctors more often. Most of the school systems, though, are trying to get the word out on what older children will need.
Students starting 7th grade will have to show that they've had an immunization for whooping cough and a second dose of the chickenpox vaccine if they haven't already had that illness. The new rules in Tennessee may not mean big changes for some parents because even though the rules now require these immunizations, doctors have been recommending them for years.
Well, now they're recommending that every single child has proof of shots and has had a well-child physical within the last 12 months. So this is going to make a massive amount of parents actually stand up and say, let me take my child to the doctor and get them checked out when they wouldn't normally do that.
You'll find a complete list of Tennessee's required immunizations available on the State Department of Health's website. Go to smartmedicine.tv for a link to get there. Kids stay crowded together from daycare to college, so it's incredibly easy for them to pass each other germs. But it's just as easy to protect them from many preventable illnesses. For Smart Medicine, I'm Doug Johnson.